This is Dr. Roger Knapp, pediatrician. I'm frequently asked with this mobile society by my patients, we're moving to such and such a town, and often to places where they're too far away to use me as a pediatrician. And they ask me, do I know anybody in that location where they're going to? I tell them I might have a friend that's a doctor there, but might be a bad doctor. How do I know? Because I don't practice with them. If you don't see them in action, you really don't know. And you could ask anybody when you go to the town, and they're of course going to suggest their physician. They wouldn't be going to that physician if they thought they were bad. It's like Johnny Carson said many years ago on the Tonight Show. He said, somewhere out there is the worst, quackiest doctor, and somebody has an appointment with them Monday morning. And so unless they've screwed up with their child, they really think they're okay. What you need to do is ask the nurses, call the nurses in the newborn nursery in a hospital in your area that you're moving to. And ask the nurses not who they recommend, because they can't recommend anybody, but ask them, who's on staff here? I'm new in town. What pediatricians work here? If somebody asks you where is a good restaurant to eat, is there any place to eat in town, you're not going to mention the worst restaurants first. You're going to mention the better ones. The nurses know who's a good and bad doctor, and the first names out of their mouth are probably going to be the better doctors. Or you can try and ask them, who do you take your child to? But if you ask them who they recommend, they won't say anything. In the main line of the hospitals, they just run through the list of doctors on their staff. Then they're not going to tell you if they're good or bad. And so to ask somebody at your church, well, who do you go to? Well, that's a good reference. They really don't know. So the best thing is to find out through the nurses. Then when you go see that physician, do they make common sense? Or do I relate to them? All of us have been to an emergency clinic and you saw some doctor and he told you something and you went, boy, that sounds weird. I'm really not feeling comfortable about that diagnosis and advice. Change. Let's find another doctor. Or even better yet is to tag along. Sometimes I'm seeing a mother and a child, and there's this other lady sitting in there, and she's just sizing me up to see what I'm like. To go meet the doctor is kind of an artificial encounter, and you really don't get a good feel for how he communicates to the mother and how he approaches the child. So to see him in action is better. So that'd be one way, is to tag along with a friend of yours who swears up and down for her doctor. And does a doctor communicate and make common sense? That's probably the best advice there. So those are some good hints on when you move to try and find a good doctor. Thank you.